Hello and welcome to this video on electrocardiography, or ECG. In this video, we will explore the different waves and intervals seen on an ECG tracing and what they represent. First, let's briefly review what an ECG is. An ECG is a non-invasive diagnostic test that measures the electrical activity of the heart. It records this activity as a series of waveforms, which correspond to specific events in the cardiac cycle. The first waveform we will discuss is the P wave. The P wave represents the electrical activity that occurs when the atria contract or depolarize. It is a small, rounded waveform that typically precedes the QRS complex. The QRS complex represents the electrical activity that occurs when the ventricles contract or depolarize. It is a larger, more complex waveform that consists of three distinct parts: the Q wave, the R wave, and the S wave. The Q wave is the first negative deflection seen in the QRS complex. The R wave is the first positive deflection seen after the Q wave. The S wave is the first negative deflection seen after the R wave. The T wave represents the electrical activity that occurs when the ventricles recover or repolarize. It is a rounded upright waveform that follows the QRS complex. Now let's discuss the different intervals seen on an EKG tracing. The PR interval represents the time it takes for the electrical impulse to travel from the atria to the ventricles. It is measured from the beginning of the P wave to the beginning of the QRS complex, and is typically 0.1 to 0.20 seconds in duration. The QT interval represents the time it takes for the ventricles to depolarize and repolarize. It is measured from the beginning of the QRS complex to the end of the T wave and varies depending on the heart rate. The ST segment represents the time between ventricular depolarization and repolarization. It is measured from the end of the QRS complex to the beginning of the T wave and is typically flat or slightly elevated. Finally, let's talk about some of the clinical implications of these waveforms and intervals. Abnormalities in the P wave may indicate atrial arrhythmias or conduction abnormalities in the atria. Abnormalities in the QRS complex may indicate ventricular arrhythmias or conduction abnormalities in the ventricles. Abnormalities in the T wave may indicate ischemia or electrolyte imbalances. Ischemia or injury to the heart muscle can cause the ST segment to become elevated or depressed. In conclusion, understanding the different waves and intervals seen on an ECG tracing is essential for interpreting ECGs and diagnosing cardiac conditions. Thank you for watching, and we'll see you next time.